I'm Lindsey Keys. I'm a co-director of the Quiet Epidemic. I also helped produce and shot the film with Winslow, and we wear many hats.
My name is Winslow Crane-Murdoch, also the co-director, co-edited the film as well, and shot the film with Lindsey. Yeah, it's the two of us for a long time, and then we have Chris, who helped quite a bit.
Hi everyone, I'm Chris Hegedus. I'm also a Sag Harbor resident, and thank you all for coming. I've been working with 5 years with Lindsey and Winslow on this journey as producer of the film.
5 years.
7.
7 years. 7 years from the start. Yeah.
Sadly, to you non-documentary filmmakers, that's not terribly unusual, and it should be. Although, I think in this case, you had a long story to tell. How did it come about? How did you find this story?
So the story found us. In 2015, I was living in New York City and had to move back home with my mom in upstate New York because I was too sick to function. And eventually I found out it was Lyme, but tested negative on the standard Lyme test for, at that point, over 10 years. So when I got to my mom's house, she let me know about this Lyme doctor who happened to have an opening in his practice, which is rare. Most Lyme doctors don't even have room for new patients because there are so few of them, so few Lyme doctors. And at my first appointment, the nurse practitioner saw the state that I was in. I was losing my memory. My everything was just falling apart. And she said, "How are you going to get through this? Do you have a passion?" And I thought that was an odd question, but it was the right question to ask. She said that the patients at their office who had a purpose had better outcomes. You basically needed the will to live and to get through the Lyme treatment, which is hard and, winding and uncertain. So at that moment, I just kind of surrendered to this idea I had for a couple years. And I said, I'm going to make a film about Lyme. And she looked very happy. And she said, we have another patient here who's your age and he has Lyme and he's a documentary filmmaker. Do you want to connect with him? So I scribbled on this little note and he still has it. And yeah.
Here we are. She didn't tell me it was going to take 7 years, but a little warning would have been nice.
You both look well.
Thank you.
Are you well?
It's an up and down journey for sure. Yes. I think we're very grateful to be so much better than we were when we started. At the very beginning of this, it was just Lindsey and I running around with a camera and barely standing upright, sometimes not standing upright. And then finally we got others involved. Chris came on board, and we have other amazing producers and editors and a team that we sort of built around it. But in the very beginning, it was us just super sick, trying to make something of the situation that we were in. And, it's so disorienting to be diagnosed with Lyme disease and to have to choose to sort of wade into this world and have to choose who to trust and what path to take. But when you're that sick, that's, you're left sort of just seeking answers wherever you can get them. And so we wanted to create something that could be a tool for folks to take out into the world, so people could watch something and comprehend why this is so difficult.
And Chris, how did you get involved?
Well, I got involved with it from my friends who are here through walking my dog in Central Park. And I've gotten several ideas for films from this wonderful group of friends. One other one showed here, Kings of Pastry. I don't know if anybody made it to the screening and event that happened around that one. But basically, my friend Enid and her husband and daughter moved to Martha's Vineyard, and they all contracted Lyme disease unknowing, and we're struggling through the years, and formed a Lyme group, and Lindsey met them. And Lindsey and Winslow were quite sick when I met them a lot of the time, or different points of the time, and she thought that they could use some help. And I was very interested in the project because my stepdaughter, one of the many, live in East Hampton, and she was bit by a tick and did not get diagnosed. She also came down with a lot of the same symptoms that a lot of people do who struggle with chronic Lyme, and we really didn't know how to help her. The medical community is not very knowledgeable about Lyme disease, especially chronic Lyme, and so I was really happy and passionate to be asked to be involved in this project.
Great. So there you two are, very sick, getting treated, which is wonderful. You meet each other. You decide you're going to make a film. If you haven't heard, filmmaking is incredibly expensive, and raising money is incredibly difficult. I can't imagine how you pursued that. Did you just start filming? I mean, clearly you made a decision not to film yourselves, or did you film yourselves for a while and then said, I'm cutting us out?
Yeah.
So how did you get this made?
Well, you can talk about the fun. I mean, it started very, Lindsey and I, we met Julia and her father at the same doctor's office where we met. Julia was offered free treatment by that doctor after she was blessed by the Pope, and she ended up on the news, and he saw that news coverage, and so he reached out to them. And so they were coming up to Albany, and we met them, and we said, hey, here's what we're thinking about doing. Do you want to be involved? Luckily, they at that point were really starting to understand the power of sharing your story and how that could actually help protect them. And they said yes. And so that's sort of where it began. And then there's also in the upstate New York, there's an incredible activist. And so we had this 5-hour meeting where we met with these two women who sat down and just walked us through everything. And that was sort of the beginning. And then, from a fundraising standpoint, we got in touch with someone who said, I'll give you $10,000 if you raise another 10K in 10 days. And that's how it,
Thanks a lot.
That's how it all began. And it worked. And so that was the first part of it.
Yeah, so we were basically living at my mom's house, which was a very small house, and my mom also has Lyme, so the three of us were quite a trio at that time, and she was feeding us, and we were just on our computers a lot, and the little donations started to come at first, and then then we got the equipment, and then we shot more, and then we edited more together, and then we built a website. It was just constantly trying to strategize. It was like this chicken and the egg situation where we needed the money to get the footage, but we needed the footage to get the money, and we were just constantly straddling that line basically up until the very end. So there were many points throughout the film where or the making of the film, where we would get in touch with someone and they'd be like, come back to us when you have a little bit more. And then we would do that. And basically there are a few Lyme foundations that are incredibly well-resourced. The Bay Area Lyme Foundation, the Stephen and Alexandra Cohen Foundation, and then the founders of a foundation called the Limelight Foundation that gives treatment grants to children. The founders of that organization, I mean, we call them our angels, because every time we were about to really go under, they would show up and they would give us the money that we needed to take the next step. And then other foundations would just we were rotating through these foundations, and families who had just been completely unraveled by Lyme. And these are people who have, in some cases, billions of dollars. And even with all of that money, in many cases, they and their children were still struggling to get better. So, and the fundraising continues for our impact campaign. So if you know anyone who needs a tax write-off, send them our way.
That's why we invited you here today. I think we all, is it possible to turn the house lights up a little bit so we can see you? I think we all know people who have had Lyme disease. I'm surprised that I don't know that I have had it. I stopped taking hikes for the most part because of it. Does anybody, it's going to be easier to say, do you not know, who doesn't know somebody with Lyme disease? Not a hand got raised. How many of you here have had Lyme disease or have had chronic Lyme disease? Yeah, and I'm sure you're not finding that. Yeah.
Almost everybody I've talked to knows somebody who has struggled seriously with chronic Lyme disease. It's really a change in what's happening, and with people admitting that this disease is out there.
Yeah. Everybody should be made to watch this, especially all those deniers should be put in straitjackets and sat down in front of a monitor. What's happening? What's the distribution? How is this getting out there? This is so important.
Well, so we're a really small team, and so we're the ones who are really lighting the fire. We are lucky to be working with a team called First Run Features, and They are bringing the film to theaters nationwide next year. We just had our theatrical premiere at the IFC Center in New York City 2 nights ago, so that was really exciting. All of our subjects and supporters and allies came together, and it's a very hopeful moment. And I think it built a nice momentum that will carry into next year. And eventually we hope to get the film on video on demand platforms, because there are people around the world who are reaching out daily through social media from 4+ continents saying, we really need this film.
Has Frontline seen it? Have others seen it? Networks? Chris, what's...
Yeah, I mean, we're kind of, the little engine that could, because we don't have a big streamer behind us like a lot of the films probably at this festival do. So we're just starting to reach out now. We just wanted to see how it started, and we've played in 20 festivals around the country, and are starting this theatrical, and I'm just starting to reach out to different broadcasters and streamers about it, and see, if they want to take the risk. I mean, in a little bit, they're going up against some of the pharmaceutical and insurance companies with this film. So we'll see how it goes. If not, we'll do it on demand on Amazon. We're going to do really robust community screenings around the country, and anybody can go to our website and sign up to host a screening of this film. And then our other big push is we really want to go to Congress with this film and try to change some of the dynamic and solutions on this. Most recently, some more money has become available for Lyme disease, but
Is there any NIH funding yet?
Yeah, there is, yeah, and there's always been funding for Lyme, but it's just been so small compared to other diseases.
Yeah.
I mean, we had that chart that comes up in the film that shows for Lyme patients, it's about $84 per patient, right? And there's more cases of Lyme disease in America than HIV and breast cancer combined, and then 10 to 20% of those people are going on to have these long-term symptoms. During the course of making this film, there was more money, thanks to a lot of activism. So there was sort of more money put into Lyme disease research. One of the things on our website that you can go do actually right now is you can go and you can sign up to write a letter to Congress. You just put in your zip code and it will send it right to your representative. What we're asking for in that letter is for oversight of where that money goes. One of the really critical things here is that as more money is added to the pot, we need that money to go to open-minded researchers who are willing to ask better questions about what's actually happening and who are actually using or actually have the questions that they're asking stem from compassion for the patients. And what we've seen so far for so long is that research goes to the same people. And because this war has been so intense between these two sides, a lot of this science, in my opinion, has been used to prove each other wrong rather than to further the field. And
Amazing.
So that's what we need.
Ridiculous. A question from the audience, perhaps. Yes.
I'm usually loud enough. I was really wondering, isn't there anything in Europe, Germany? I mean, I was so hoping for something going on elsewhere.
You mean therapies?
Research, yeah.
Yeah, so there are some clinics in Europe. They are out of pocket. And so we know a lot of people who have been to those clinics, but they're people who have access to millions and billions of dollars and who can take time off of work, in some case months or years. And but even still, those therapies are uncertain and potentially lifelong. And so we have heard some stories of hope coming out of those clinics, and I wish that there would be clinical trials actually using these alternative therapies so that they're no longer considered to be alternative. But the issue, of course, is that they would then threaten other products that might be more profitable.
I would also just add to that quickly. The CDC really has exported. Lyme disease is considered to be an American illness because it was discovered in Lyme, Connecticut, even though research shows that back in the early 1900s, this was found in Europe long before it was found in Lyme. But it's really considered to be an American illness. And so what the CDC says and those guidelines that come from the IDSA are used all throughout Europe. The other thing that's really interesting is we run into so many patients here in the States that are coming to the States to get treated because in their nationalized healthcare systems, there actually is no way to go outside of the treatment guidelines. And so, it's an interesting thing where actually in the system that we have here, you are able to practice outside of insurance companies. Of course, that means that the only people who are getting care are the ones with the means to be able to go outside and do that.
Or they declare bankruptcy.
I can only imagine you two sitting at your laptops doing research and discovering one more ridiculous thing after another. Hey, look at this. Oh, Jesus, are you kidding me? And it was like never ending. And you do that so well in presenting it. We have a question here from the gentleman. You'll be next.
Building on that 100% satisfactory answer from both of you, I have personal experience of going to Germany on our own family support to get hyperthermia treatment. So the services do exist, but they're out of pocket, and that Winslow's correct. All the other countries do rely on American peer review medical research, and they're very slavish. Apart from some pockets of places like Bavaria, where there's this cancer clinic came up with a hyperthermia method that they found for treating cancer was actually curing latent Lyme disease. So there are things like that. Places like Australia, hard to believe there are countries that are more closed down and denial in their medical systems, but Australia is even worse than ours, and that's where most of the patients of the Dow's clinic, the Clinic St. Georg.
Thank you. I want to hand it forward to this gentleman.
Thank you again for the great film. It seems to be an indictment. You make an indictment, really, of the NIH and the CDC. And with COVID, did you see any improvement? Have you moved them in a way? Because, I mean, the indictment is really severe. I mean, it's not just bureaucracy, but it's also conflicting research that then slows down research everywhere else. And that to me is criminal. And now we are the center, and they're exporting the wrong guidelines into the world. Have they come to any kind of a change?
Well, I'll answer part of it. I feel like, so I think the guidelines haven't changed, and that's problematic. I think that many of the people in the Lyme community who feel hopeful are hopeful because the people and the masses are waking up, because we're having conversations like this right now. We don't know what's coming as far as the federal government's response to the awareness and that's rising and the consciousness that's rising so clearly, even in rooms like these. So although the guidelines haven't changed and the funding is still going to these same scientists, I think, and Winslow can speak a little bit more about this as well, but there's an openness now to the possibility that we don't have it all figured out and we might need to reevaluate, and that's a good place to start.
Yeah. Oh yeah. Okay. Yeah. Yeah.
If I may make a statement and also a question. My question was related to is there any consideration of change to the panels in which the doctors test with? Because even if you convince them to possibly test you, they're just really looking at Lyme. I was later diagnosed with myomoti, and most of my physicians on Long Island, where it's an epidemic, hadn't even heard of the strain. And if there were a panel that was like the go-to that had the multiple pieces, possibly more people would be diagnosed. Is that ever a conversation?
Yeah, I think that's a conversation just in general, that we need better diagnostics and we need better therapeutics, and so we need a direct detection test, one that's not just looking at antibodies to the disease, because one of the issues with that is, it takes a long time to test positive, and so that's the point that you want to be treating the disease, is when you're still testing negative early on in the infection, and then even later in the disease, it's as we see in the film, it's really not accurate. But then yes, there's other strains. I mean, they would claim that those tests are supposed to cover some of those strains, but we know that they're just not that accurate in general. What Dr. Spector was doing was trying to create a direct detection test that shows that you actually have the bacteria still. And what that does is that also allows you to see how treatments are working. One of the big issues with the test right now is we don't know how the treatment is progressing, because if it's an antibody test, so there's no way to measure our impact of the treatments that we're using.
Thank you. I think what we could all do, we're out of time. I'm sorry. What we can all do is go on their website and tell all your friends and everybody you've ever known about this. And thank you for this really, really important film.
Thank you all. And if you're in New York, we're playing at the IFC Theater till December 8th.